I'm Bart. I'm a Dutch doctor, and I came from the Netherlands to Paris to tell you the story of why I'm a Twitter doctor. And I also stand before you as a very proud father. These are our two sons, two boys, and Dan, who's the oldest one, he's the creative one. He's going to be graduating as an industrial designer from the Design Academy in Eindhoven in about 2 weeks, so I'm very proud of that. And Frank, on the left-hand side, he's 14, and he's the smart one. He's the thinker. He gets great grades at high school, but he's also the one that asks the questions that are sometimes difficult to answer. So now when these kids grew up, we worked as, my wife and I, we worked as general practitioners, family medicine, médecin de famille, and we had our own surgery which was right next to our house, so they saw the patients come and go, and sometimes they'd play where we worked. So they had a fairly good idea of what we did as doctors. And after doing that for many years, I decided I wanted to do something different, so I started working with developing e-health programs. So that's what I do now for a living. I work at a company that develops e-health programs. And I started doing a little bit of science, so I do some research at the University of Twente. And also, about 2.5 years ago, I started doing consultations via Twitter as a Twitter doctor. Now, Frank, he doesn't see much future in Twitter. He's more of a Facebook man, he's probably right. And actually, he thinks I'm not a real doctor anymore. It's a little bit delicate subject in our house. So my wife, she still works as a GP. She's the real doctor in his opinion, and I'm not. And a while ago, he saw me answering questions on Twitter, and he asked me, "What do you do on Twitter?" I say, "Okay, well, I answer questions that people ask me, and I try to help them with that." And he thought for a little while, and he said, "Okay, but why?" No, he said, "How do you do that?" And I said, "Okay, well, people ask me a question. Sometimes I need more information, so I tweet them back, and they send more information. Sometimes they send photos or videos, or I direct them to a website, and that's how that works." And then he thought for a little bit more, and he said, "Okay, but why, Dad? Why on earth do you do that?" Boom, bingo, that jackpot. That's the right question. That's what you want to know. Why on earth would anyone in his right mind, especially a doctor with a college education, do what I do on Twitter? Told you he was a smart kid. Now this is Simon Sinek explaining his golden circle. And he says, well, it starts with why. Everybody can tell you what they do, and some people can tell you how they do it, but very few people can tell you why they do it. And that's the inspiring part. That's what motivates us. That's what gives us purpose. So in my talk, I'm going to spend a little time on what we do with our Twitter service and how we do it. And I try to spend most of my time on the why. So what do we do? Now, Twitter is a microblog, and you can send short messages, maximum of 140 characters. And you can do that either via the public timeline or via a more or less private direct message. Now we did about, in the last 2.5 years, we did about 4,500 tweets. It's an estimate because Twitter's not very reliable, some get lost. And we have about 2,400 followers as of last week. If you think that's a lot, it's about the size of an average family medicine practice in the Netherlands. And if you think that's a lot, think again, because we reach about 0.014% of the Dutch population and about 0.6% of the active Dutch Twitterers. We found that very disappointing. We're not even in the top 1,000 of most popular Twitter accounts. So that's not very inspiring, what we do, don't you think? So let's move on to how we do it. Now, did we have a plan? I mean, you pretend to be a scientist, so did we do a needs assessment or a stakeholder analysis or even an e-health readiness test, or is there anything like a business plan? Nope, there isn't. We just started with a tweet. And I think that's the story of how we do what we do. It's a story of unexpected connections. And unexpected connection is something that we know from science, from creative problem solving. We know it from, it's also called, sometimes known as serendipity. And on the left-hand side, you see the first microscope that was invented in the 17th century by Antony van Leeuwenhoek. He's a Dutchman. And, but he was a jack of all trades. So one of the things that he did was he was a glass blower. And he found out that the little droplets of glass that were left over when he finished the glass were perfect to use as lenses. And that gave him the unexpected connection to make the first microscope. And later, Alexander Fleming, he made the unexpected connection that penicillin, that a fungus that produced something that can kill bacteria, and he used a microscope invented by Antony van Leeuwenhoek to invent penicillin and find out how that worked. And I think the history of Tweetspreekuur, our Twitter service, is also one of an unexpected connection. There's the unexpected connection between Erik Janssen and Philip van Dijk, the two people with whom I started Tweetspreekuur, because we didn't know each other. We met on Twitter, and about a week before we started, we sat down together in a room for the first time in our lives and made plans how to do this with the Twitter service. And the unexpected connection with Lucien Engelen from the Reshape conference in Nijmegen, who said, okay, I think that's a good idea. Why don't you come tell about it at our conference? And we did. This is a picture of how we told what we intended to do. There were only a handful of people listening to us. So we thought, well, that's not going to be much, I think. But then there was the unexpected connection with the media, and this is what happened. Hi, I'm Bart, and I'm a Dutch doctor, and I need your help.
Goedendag, Erik Janssen. Ik ben huisarts van de Tweetspreekuur.
Je hebt griep, een ontstoken oog of een andere kwaal, maar wilt niet meteen naar de dokter. Dan kun je nu ook terecht bij het Tweetspreekuur van een Nijmeegse arts. Als je je klacht tenminste in 140 tekens kunt beschrijven.
We started with Tweetspreekuur. It's a very simple thing. It's a free service on Twitter, but it works because you, the people, made it work.
Well, you know, I've always had my own opinion about things.
It's the patient, stupid.
Well, let's put it this way. It's been very good for me, so I hope it's all very good for you.
So we got picked up by the media. And I think you can say that the unexpected connection is also there between doctors trying to treat or offer a consultation service on Twitter and social media, because Brian McGowan, who has done quite remarkable research on the subject, says, well, doctors use social media to teach and they use it to learn, but they don't really use it to do what is their primary business, which is caring for people, so trying to treat people. So there's an unexpected connection also. And he says, well, there's very little data, so we try to collect data, and what we find is that what we do on Twitter is exactly the same what happens in the consulting room, the same subjects, the same things that are going on there. And now we get to the good part, which is, of course, the why. Well, there's a number of why. There's 4 whys, and one of the whys is that we found that we can touch people at a distance. And sometimes we find that we can even better help people because of the distance. And that really made me wonder, how is that possible? Because in medicine we usually think, and Abraham Varghese, the famous American physician and author, he says, your greatest asset the greatest asset of a doctor is the human hand and his ability to touch. And still we can touch at a distance, and I think it's a well-known psychological phenomenon that if you can look at a problem from a little distance, still be engaged and connected, but still from a little distance, then you can come up with more creative solutions, and that's what we found. The second why comes from you, our users, the patients, and we asked them, why do you use our service? And 217 people were kind enough to give us an answer, and they said, well, there's 3 reasons. We want your advice, we want reassurance, and we want triage, and triage is this a serious problem? Should I do something with it? Should I go see a doctor? And we also asked, do you trust us, the people behind the tweetspreekuur? And 98% of you said, yes, we trust you. And that was, of course, a very, very important signal to us that people are actually appreciating what we do. Now, Susanna Fox, from the Internet American Life Project, she says, well, things are about to change in healthcare, and there are a number of beacons of change. And one of the beacons is expert patients. The other one is committed, engaged, compassionate doctors. The third one is technology. The technology is there. And I think, well, one of the best patient advocates is Dave de Bronkart. His name has been mentioned many times already. He was diagnosed with kidney cancer, and he took matters in his own hand because he felt he wasn't getting the best treatment. And he found what the best treatment was, and ever since he was treated, and ever since he's traveling around the world and telling his story. And I know of no one better that can tell that story with more compassion than Dave.
And I ask you 3 words, please, to improve healthcare. Let patients help. Let patients help. Let patients help. Let patients help. Thank you.
And as you can see, I was there, and I listened, and I thought he was right. Now, you might wonder, well, Dave's an American, and there's not many like Dave. So surely in Europe, this is not going on like that. But I think it is. We have our own ePatients. And on our Twitter one day, we received a photo from a young lady. And actually, her question was about the little brown discoloration on her throat on the right-hand side. Well, she didn't like it. She wanted to know if anything could be done about it. But we, as doctors, we were a little bit worried about the red stripe on the left side of her throat. And so we asked a question about that. And then she sent us a picture, another picture. It was this one. So this is a lady with a brain in her drain, with a drain in her brain. And she has had brain surgery for 18 times, and she was about to go in for the 19th. And what she was looking for was a sounding board for her to participate in her own treatment. And even though she was getting very highly specialized treatment in a neurosurgic academical center, she still needed somebody to talk to, and she found it on our Twitter service. So there was another unexpected connection. And this lady is also an artist, and so she made a painting of how to stay brain sane. And that was a very inspiring experience for us, and it even led to the fact that my colleague Eric went to the hospital during her 19th admission and visited her there. Another unexpected connection. So, I think healthcare needs to change its course, but the ship of healthcare is very, very large, and it's not very easy to change its course. I used to work on the big ships, or one of the big ships. Sometimes I feel that I more or less dropped off, or maybe got pushed off, and I'm now in the little boat. So I get wet every once in a while, but guess what happens? It gave me back my compassion for care, and that's a very special thing, and I'm very happy that I found it by doing what I do. So back to our sons. When I told this to Frank, he said, okay, I understand you're not a regular doctor anymore, but I think you're kind of a special doctor now. Well, I told you, he was a smart kid. Now, this is a patient-included conference, and I think every medical conference should be. So to all the patients out there, I would like to say one thing. And I'd like to use the words of the great musical genius, Brian Wilson, to say it. And that's true. Doctors and patients, they do not always love each other. There's one thing that we're sure of. We're in it together. So that's why I say to you also, God only knows what I'd be without you. We're in this together, and that's why I'm here, and that's why I do what I do, and I'd like your help to do it. Thank you very, very much.